guys hop on, feel free to comment in the chat. Uh, if you have questions that come up today, will you post those in the Q&A, please? We would love for you to do that. Good conversations that we're having, just talking about illnesses and the effects of mental health on things that we may be struggling with. And actually, that's probably a really good webinar to dig into again sometime
Oh,
soon.
and vice versa. In fact, I had somebody today that one of my patients died. So I've talked about him a lot. He's the one that uh, cured his or reversed his heart disease by fasting for 30 days with water only. And what did he do? Well, he had terrible chest pain and terrible heart disease. He had schizophrenia also. And so we think that they're separated, that the mental health is separated from the physical health. It is not separated. In fact, if you look on the machine learning programs where they're looking at what are the risk factors for heart disease, cholesterol doesn't show up on it. High blood pressure is way down on the list. The top ones are like lifestyle and mental health issues. Those are way up there for heart disease. So that's why when we looked at the reversing heart disease in our kit, we talk a lot about stress because that's a big deal. And it's really probably more important than all the things that most other people talk about. Your cholesterol levels, the drugs you take, your blood pressure, what you eat, how much exercise you get. Yeah, some of that's important, but it's of minor importance compared to the stress part.
Yeah. Yeah, I think we better dig into some of that again in an upcoming webinar. And we do
That's
that.
good.
We touched on it. But yeah, so good. It's important for us to talk about. So we already had planned today that we are going to talk about neuropathy because I think we probably get questions about neuropathy on just about every webinar. A lot of people wondering about that. I talked about or talked with a person today who had just said they were noticing a lot of tingling and some nerve issues, in their feet. And um, some people are just being told that that comes with age. And I find that really interesting. And so we're going to ask Dr. Saunders about that. So let me just put this disclaimer out there. Dr. Saunders is a wonderful medical doctor, but he is not your doctor. And so we just encourage you to talk with your healthcare provider before you implement any of the things that we talk about today. And so let's talk a little bit about neuropathy, Dr. Saunders. I was actually looking this up. I think there are a lot of different ways or a lot of different things that can probably be going on in your body when you have tingling in your extremities, right? And so that's the first thing that people usually ask is they'll say, "Oh, I'm feeling tingling or I'm feeling numbness." What's the difference? What does that mean? What is neuropathy? Help us out here.
Good question. So today I had a woman came into the office and she wanted to know about her sciatica. So her pain goes from her waist down her backside, all the way down the back of the leg, down into her foot. And it follows a very specific pattern that I looked it up and corresponds to the nerve root. The nerve root is the nerve that's coming out of the spinal cord. So you have the spinal cord and the nerve root comes out and it goes down the leg and goes all the way down to the foot. And she has paresthesias, sensations, weird sensations, abnormal sensations. What does that mean? Well, pain. She said it's kind of a pressure like sensation and tingling and numbness. And if I pound on it, it hurts. And so these changes in sensation are happening in a very specific pattern. So I know that's a neuropathy. It's not a problem with the blood vessels. It's not a vascular circulation problem. It's not a problem with the muscles or joints or anything like that. It's not an inflammatory condition. It's a neuropathy because it affects a nerve. So neuro means nerve, pathy means a problem. So you have a problem with the nerve. And that's why neuropathy is anything. It's like any problem that you have with the nerve. So is Alzheimer's disease a neuropathy? Yeah, that's a neuropathy. Any other dementias, neuropathy? Yep, neuropathy. Lewy body dementia, is that a neuropathy? Yeah, that's a neuropathy. What about if you get a tweaked neck and you feel numbness in your hands? Is that a neuropathy? Yeah, that's a neuropathy. What about carpal tunnel syndrome? Is that a neuropathy? Yeah, that's a neuropathy too. So anything that affects the nerve, that has a problem with the nerve, any part of your nervous system is neuropathy. So what we're talking about mostly with diabetes is peripheral neuropathy from a lack of energy. It's an energy problem. And it's really important to know that the nerves are exquisitely sensitive to a lack of energy, more so than the muscles. Why? The muscles can just relax. They can just like, okay, and they can be bland. And you can say, boy, I'm feeling really weak. That might be a muscular problem, but it might also be a nerve problem. Whereas the nerves are like constantly firing all the time. They don't stop. They don't stop. When you go to sleep, this is the weirdest thing in the world. When you go to sleep, your brain shuts off the all of the nerve impulses that are coming in from everything. So your ears are hearing things, your eyes are seeing things. Well, not much with your eyes closed, but still, if there's light coming in or something like that. The sensation of like the sheets over on your bed and all of that, that's all sending signals to the brain, and the brain just goes, shuts it off. So you don't feel any of that. And that's how you sleep. You sleep by shutting off all of those nerves that are constantly sending signals. So the nerves need a constant supply of energy to do that. And if they're lacking in energy, then they start getting weird. They start sending weird signals. They start sending tingly signals or itchy signals or nothing signals, which is numbness. Numbness is when there's nothing. So normally every second of every day, you have millions of nerves sending signals to your brain saying, I'm here, I'm here, I'm here, I'm here, I'm here. Look, my foot's here. And what's really weird is someone has an amputation, like of a limb. They get something called phantom limb syndrome, where those not the nerves themselves, but the nerve bodies that are in the spinal cord that were feeding that area are sending signals saying, I'm here, I'm here, I'm here, and there's nothing there. That's kind of a weird thing, but that's a real thing, actually. So having those signals all the time means that those nerves need energy all the time. And when you have like type 2 diabetes, or if you have toxicities of some kinds, I've had people with lead toxicity, mercury toxicity, that blocks the energy production generally in your body, and your nerves are the most sensitive. And guess which nerves are the most sensitive of all your nerves? It's your feet. Why? Because they have to send a signal from your toe all the way up your leg, because the nerve cell is actually in your spinal cord. So it's in your back. So that's the longest of all the axons, the wires. So it has to send a long signal all the way up. So if there's any lack of energy, where is it going to show up first? Well, in the feet. So that's why people with diabetes get peripheral neuropathy that starts in the feet, and then it starts moving up to the ankles, and then it starts moving up to the calves. And when it gets to the knees, then you start feeling it in the fingers. Why? Because that's about the length, that's about how long it takes from to get from there all the way to the spinal cord there. And about the same distance, to the back there. So so when you start feeling it in your fingers and your knees are feeling numb, then you know that peripheral neuropathy is moving, and that means you're getting less and less energy, because the blood vessel, the circulation is not as good, and that's another issue with the circulation getting to your feet, right? So without good circulation, you're not going to have good energy production. and then the nerves themselves are not producing a signal. It's not going to your brain saying, I'm here, I'm here, I'm here. There's nothing there. So the brain is, so you just say numb, numb. There's nothing there. So what do you have to do? You have to increase the energy production. So the way to increase the energy production is to improve your insulin sensitivity. That's the first thing to do, because insulin blocks you from using fat for energy. Why is that important? Nerves just use glucose. We actually use 60% of our energy comes from fat. And when you have insulin resistance, then you have a decreased ability for the glucose transport to get into the nerves as well. And that affects the brain too. They have seen it with metabolic problems, women, especially because women are more likely to get Alzheimer's disease. They see the early effects of Alzheimer's disease with insulin resistance at age 20. So these are 20-something year old women that they're testing for Alzheimer's, and they already have decreased blood flow, not blood flow, but energy in their hippocampus where the memory centers are. So, you don't wait until you can't remember things, can't think clearly. Start right away to get insulin sensitivity, because that's what you need in order to prevent and treat neuropathy. There was something Cheryl had, we have a supplement called Nervala.
Nervala.
Yeah.
Supplement called Nervala, which is specifically formulated for neuropathy. It's got, we'll ask Dr. Saunders to talk more about it because he helped formulate it, but I'm sure he's going to highlight ALA, which is alpha lipoic acid. And I always, does this have benfotiamine in it? Benfotiamine as well. So it's basically going to help you get rid of inflammation in your nerves and help conduct the nerves better, particularly when you have diabetic neuropathy. So.
Oh, go ahead.
Go ahead.
Well, I was just going to ask, someone had mentioned this while she's showing this. Is there a difference between diabetic neuropathy and peripheral neuropathy, as in MS, as they're both treated with Nervala?
Okay. MS is a different reason for having a lack of energy to the mitochondria. You actually lose mitochondria in multiple sclerosis. And so you need to increase the mitochondria in MS. And yes, Nervala can help with that, but it's not the full answer for MS. Diabetic neuropathy is a type of peripheral neuropathy, and that has more to do with circulation. So benfotiamine is vitamin B1 that helps restore the glycocalyx and the function of the lining of the blood vessels, the vascular endothelium, so that you get better blood flow. And then the Nervala is an anti-inflammatory to decrease inflammation. And that allows the nerves to regenerate, or the nerve signals to regenerate. The nerves are still there, but the nerve signals regenerate. So MS is a different reason for loss of energy, and more studies or tests. You need more tests to find out why the MS is there.
I'm gonna have Cheryl post that link.
Yeah, I'll post it. If you have numbness, burning, or tingling in your feet, this is when you'd want to consider Nervala. Or if you've had diabetes for a while, you probably have nerve damage and don't even know about it. So this is something you'd want to start to help start that microcirculation that Dr. Saunders was talking about. So I'll post this in the chat, and we do have a coupon code for you as well. Webinar 25.
And so I'm also curious about this. So Joe, the founder of Barton Publishing and Nutrition, says, he takes it at night and he thinks it helps him sleep. Why would that be, Dr. Saunders?
I don't know. Maybe it's a placebo effect. Maybe I don't know.
Yeah.
Increasing circulation. I don't know why.
Okay. Yeah. All right. There was another question about this. Let's see. Oh yeah, Delma had said I'm diabetic and had tingling in my feet. Your Navala has stopped that problem. Thank you very much. That is awesome. This is one of the supplements that I think we do hear people using without even making other changes, and it seems to have a really positive effect on them. Not that our other supplements don't do that as well, but this one is one that people have implemented before they've tried anything else and they've noticed changes. So good, good ingredients and a good product. Very popular. Yeah, Cheryl just typed in webinar 25. Those of you on YouTube, I'll post that in there as well. Let me see here. All right, let's ask another question here. Susan said, well, actually, this one's related to anxiety. What are your top supplements to help with that?
Okay. Find out why you have anxiety. Anxiety is really important, and it's not something that is universal. It's not something that everybody has the same reason for anxiety. Some people have anxiety because of PTSD. They've had a terrible experience and they get anxiety from it. Anxiety is the feeling of instability, like you're unstable, like you're not walking on, like someone pulls the rug out from under you. It's like that. Or that something you're out of control with, or like something bad is going to happen to you. The anxiety that's induced from that is one thing, as opposed to anxiety from my brain doesn't function right. There's something wrong, and there's anxiety associated with that often as well. People that get strokes often get anxiety. People who have MS or other neurological problems often have anxiety. So finding the underlying cause of your anxiety and dealing with that, rather than just taking anxiety supplements, is the best idea, because sometimes it is biochemical and you need to deal with the biochemistry. And in that case, you may need, the usual like taurine or kava kava or something like that to help with anxiety. But sometimes it's something that needs to be fixed. Like you have toxicity. If you have mercury toxicity, you're going to get anxiety from that, and you got to get the mercury out. So finding the reason and dealing with that is the best way.
I saw a message come in from, I think it was Sib. Yep. Can someone be born with anxiety?
Yes. All of us are imperfect, and everybody's born imperfect. There's no perfect person in the world. So we all have polymorphisms in our DNA, and then we also have our uniqueness of who we are. But anxiety is something that some very young children, you can't always tell if a little baby, but mothers sometimes say, yeah, this child is very anxious. And a little baby that can't talk yet, an infant that needs a lot of comfort. So yes, you can be born with anxiety.
So if you're talking like it can that neuropathy could be associated with Alzheimer's, would Nervala help with like brain fog or confusion then?
It's possible. I have a lot of patients that have um, microvascular disease. So we'll do an MRI scan and we'll see microvascular disease. And I put them on Nervala to repair the microvasculature. It's one of the things we do. We also put them on omega-3 supplements to help repair that. And then fucoidan and glucosamine, glucosamine chondroitin. And so those are the building blocks of making that lining of the arteries so that blood can flow better in the arteries. So yeah, Nervala has been a part of that too, because the benfotiamine helps repair the blood vessels.
Good.
Didn't get myself off of mute. That was kind of fun. All right. Okay, so Terry says, oh, this is Susie. Can a cancer patient that is in remission and also a type 2 diabetic and has high blood sugar as well as a senior and is losing a lot of, no, and is losing a lot of weight gain weight? This is Susie. Uh,
Okay. Okay. Can someone who has cancer and diabetes and is losing weight,
oh,
can they gain weight? That's the question,
okay.
right?
Okay.
Okay. Okay. So,
Yeah.
yes, you can gain weight. It's not easy, but what you really want to gain is muscle. So, just having weight isn't necessarily the best way. So, it's going to require some exercise. It's going to require adequate amounts of protein. It's going to require eating some fat. It does not require that you have sugar. Um, if you uh, fast at night, so that you make IGF-1 is insulin-like growth factor 1. That helps you to put on muscle and improve the strength of your muscles, for example. So yeah, it's possible to gain weight. A lot of the weight gain stuff, though, you have to be careful with, because if someone has type 2 diabetes and you're putting them on these super high sugar things for weight gain, then they're just going to put on abdominal obesity, and it actually makes the cancer worse. So, not a good idea.
Okay. All right. Elmer says, have you heard of the cardiovascular docu-class video series? If yes, what do you think about them?
No, I have not heard of that, and
Either.
can't comment on that. Sorry.
Okay. Burl says, anything that will help with essential tremor. I have type 2 with fatty liver, chronic liver disease, stage 3, anxiety, depression, Garrett's esophagus, hyperlipidemia, and hypothyroidism. I'm 76, no pains.
No pain, painless. Okay, so you have a lot of issues, but they're all painless issues. Okay, and then the question about essential tremor is a very good question. The answer is very difficult because it's like I have several patients with essential tremor, and I've tried a lot of the recommended things out there, and I have not seen any benefit from it. I haven't had any of my patients benefit from it. It seems like the single best thing that would probably help all of those things is to have adequate sleep. And that means 8 hours of sleep every night. And I know that's not easy. We should do another whole webinar on sleep. But these kinds of things, this kind of like essential tremor type of neuropathy, a fatty liver, people who get enough sleep, it lowers their stress hormone levels. And the stress hormone levels, then you don't get as much tremor because you don't have as much stimulation. The fatty liver goes away because you're not as hungry, you don't eat as much. Type 2, it helps that too. And so I think just starting with that would be the best thing. The other thing that I would do is start doing a lot of tests to see if your essential tremor is something biochemical. I would do like an organic acids test to see if you detox well and get rid of your organic acids, and energy tests for mitochondria, and to look at why this might be happening.
Okay, I saw a message come in. Mercedes said, I had developed essential tremors and it says shopping, but it could be stopping. I'm not sure. And oxyolotic med, my tremors completely stopped.
Oh, so an anxiolytic medication, something like benzodiazepines, can completely stop.
Mm,
And there are others. Yeah, some of those can increase the GABA and stop an essential tremor.
okay. All right. Let's see. Lily says, I wake up every day with a mild shaking Oh, interesting. Okay. I wake up every day with a mild shaking that seems to come from the high chest or maybe brainstem. I can sometimes breathe it away. Puzzled by it. Vagus nerve? Is there some testing that might be helpful? Taking B1, RALA, magnesium glycinate.
Yeah, well, so B1 and RALA, that's essentially what Nervala is, right? And then magnesium could be important. But that's a really good question about is it the parasympathetic nervous system? Is it the vagus nerve? Because breathing techniques that you use, abdominal breathing or diaphragmatic breathing, helps you to use your parasympathetic system, and it balances the parasympathetic and sympathetic, so that you don't have one dominant over the other. Like usually the sympathetic, which is the stress one, is dominant over the parasympathetic, and if you can breathe, then that brings them more into balance. So yeah, that's great.
Interesting. Okay. Whitney said, what else should I take with Nervala?
um, it's not as much about the supplements as it is about finding the underlying reason. So if your problem is like type 2 diabetes, then fix that first. That's the number one thing. It's not necessarily popping the pill. Yes, that'll help to restore the blood flow and improve the nerve function. But that's not the fix. The fix is actually to get your insulin sensitivity up, to have good normal insulin sensitivity so that your nerves can function well.
Okay, Peter said, what about neuropathy caused by chemo treatment? VA doctors. Oh, go
I was
ahead.
going to add, if she needed help with that, then we have the diabetes solution kit to help with the diabetes for your blood sugar. And not just to plug another supplement, but we do have synochroma and berberine and fibergreens to also help with, to help you regulate your blood sugar. We're not trying to do
Yeah.
anything for you,
Oh,
but
did we
these are
lose
the
you?
tools you can use to help. Sorry. Sorry to interrupt you, Leslie.
I says my internet is not stable. Can you hear me?
Yeah. Yeah.
Oh, that was weird. Okay. I missed half of what Cheryl said. My internet went out apparently. So if it does it again, maybe wave to me or send me a chat message and let me know you can't hear anything. Okay, so let's see. Peter had said, what about neuropathy caused by chemo treatment? The VA doctors told me that neuropathy in my feet was caused by chemo treatments and might go away on its own, but it hasn't after 8 years. Is there any treatment for
Uh,
this?
okay, that's a hard one, because the chemotherapy actually does damage to the mitochondria, and that's making energy for those nerves. And so it's not just a matter of restoring the blood flow and increasing the energy production. You actually have to make new mitochondria. So that requires more. You have to exercise. There's some supplements you can take, which would include a good mitochondrial supplement is going to contain CoQ10, L-carnitine, D-ribose, alpha lipoic acid, and PQQ, pyrroloquinoline quinone. That's why it's PQQ, because no one can pronounce what it really means. And vitamin B12. So there are supplements, and there's like ATP or mitochondrial supplements, and as long as it's a good quality brand, then that's good. But it's also the physical therapy part. If you don't exercise, you don't build mitochondria. You're just taking pills, but that doesn't do anything. That's like thinking you can sit on the couch and build muscle, even though it says on the TV you can do that, or or thinking you can sit on the couch and build bone. A lot of people are popping pills that say, "Oh, this is to build my bone," and it doesn't really build your bone unless you're actually exercising. So yeah, get out, exercise, take a mitochondrial supplement, and then you can repair that over time as you build mitochondria. But 8 years, ooh, that's a long time. I don't know. If it depends. If they're just asleep, then they'll come back. But if they're dead, they're not going to come back.
Okay. Sienna says, my friend has had fibromyalgia for many years. She has had to take pain relief medication every day to not be in pain all the time. Can Nervala help her nerve issue associated with pain related to the muscle area?
Okay. Can Nervala help? Yes, it might, if that's the issue. And so that's where the testing comes in. Why the fibromyalgia? What is fibromyalgia anyway? Fibromyalgia is not an inflammatory condition, it's a lack of blood flow. And so it's the autonomic nervous system closing down the blood vessels to certain areas. That's why someone with fibromyalgia, one day can have like pain on one side, or for weeks or even months, and then it moves somewhere else, and now my leg is hurting, and now I can't sleep because my back is hurting, or that it can move around the body, and it can cause sensitivities, but there's no inflammation, so you can measure inflammatory markers, not normal. And it used to be that people with fibromyalgia, they were told, it's all in your head. It's because we tested and your inflammatory markers are negative. You don't have like real arthritis. You don't have any real problem going on because it's not inflammatory. So that's a problem, right? Because then why am I in pain, right? So the fibromyalgia causes a constriction of blood vessels, so you have a lack of blood flow. So you build up like lactic acid, and then you get spasms when you try and use some area. Or if you're laying in bed and you have a pressure in one area, you already have a lack of blood flow. Now you've cut off the blood supply completely, and it gets more painful. So it's not like it's comfortable to lay in bed. So for all these reasons, how are you going to increase the blood flow? And that's really what fibromyalgia comes down to. And taking pain medications doesn't help the long run. It really helps the short run, but it makes the long run worse. So I often put people on what's called low dose naltrexone, which is something that blocks the opiate receptors, the like morphine and all codeine and all those receptors in the brain, and tells the body, hey, make more endorphins or enkephalins. And that allows the body to not have so much pain. And then the other part is to control the autonomic nervous system. And that is try something called the Wim Hof method. That's one good way. Yoga can be helpful. The autonomic nervous system is really, you don't have control over it directly, so it's not an easy thing to work on.
All right. If you guys can post your questions in the Q&A, that would be really helpful. Thank you. Message here from Lee on YouTube. For blood flow at cell level, are you referring to the capillary between artery and veins?
Capillary, that's the blood flow at the cellular level, right? So capillaries are so small, they're microscopic. A single red blood cell can squeeze through there and literally like fold and squeeze through there. That's how small they are. So yes, at that level, that's part of it. But even the microvascular level, like the arterioles, it's still in the arteries, but not quite to the capillaries. So just before the capillaries, there's very tiny arteries that also, if they're not very functional, then it's really hard to get blood through them. And that's not an inflammatory condition necessarily either. That's really just the glycocalyx, the lining of the artery isn't working.
Okay. All right. Paul says, how effective is Nervala? These days on YouTube, we're inundated with videos that all seem to be trying to persuade us to jump for one kind of natural supplement or the other. Neuropathy, erectile dysfunction, arterial plaque, and lots more. How can we know if these are legitimate or scams?
Good question. So if you buy Nervala on Amazon, it could be a scam. I've actually had one of my patients called me and said, why I got these new pills, it was Cinechroma. I got these new Cinechroma and they used to be like cinnamon colored, like brown, but now they're white. How come the colors changed? And I'm like, so I called up Kevin. I said, Kevin, what's going on? And he said, "Oh, those aren't ours. Those are copies that come from China or wherever, and they're just people that are scamming people, using our name and our labels to sell things, and they sell it at like $10 less than we sell it for.
Yeah.
So there and there's nothing in it. There's nothing in the pills. It's not. You have to be really careful. How do you know? I don't know because the label, he says, it's like playing whack-a-mole with those guys. You pound one down and they go away and another one pops up over there. And then you pound that one down and another one pops up over there. And Amazon is just selling them. Whoever wants to sell on Amazon can just sell it. And they don't have to prove that they're from our company. So it's not that easy. Okay, so one thing you can do is buy it from a reputable company. Number two, make sure you're buying from the company and not from, Amazon, not from some someone that's like a reseller or something like that, because that's most of the time that's a scam. So, and I don't know the best way. I see things on like eBay too, and I had a woman in my office today. She has real bad tinnitus. Her ears are ringing really loudly. So she went online and she watched this whole 30-minute video on how this doctor said this, and my mom got better, and because my mom got better, I did this, and this whole long video. She finished the video and she bought some. And she took it and she looked at it on the label and it's just like B vitamins, like a multivitamin B vitamin supplement. But she took it anyway and it didn't do anything. So she called Amazon. She says, I think this is like a scam. And so they gave her money back. I don't know. I don't know how to tell.
Yeah.
I've heard lately a lot of people talking about don't buy supplements from Amazon because they have fillers. So basically what they're trying to say is that they're just putting ingredients to fill a capsule that really doesn't have any potency, anything in it. So that is a danger. We do get reviews. So if you go to bartonsupplements.com, I think you can find them on the Nervala site, but I'll read a few of them that I find access to. This item has really helped my feet a lot, and I mean a lot. My feet normal again. They feel absolutely great. That was on April 15th. Only just begun 4 days ago, so too early to tell. Looking for wonderful relief. That was on May 1st, but here's one from May 23rd. I've only been taking Nervala for a couple of weeks, but I'm already seeing improvement. Thanks, Barton Publishing. And how long do you think you should take Nervala to actually see results, Dr. Saunders? Like, it's not an overnight relief, is it? It's may take a week or two or three.
Or 2 or 3, yeah. The research was done for 90 days, and they looked at people after 90 days of taking these supplements to show that they had improvement in their nerve function. So I would give it 90 days.
Okay. Cynthia said, is Nervala good for toxic neuropathy due to chemo pills? And what food, vitamins, etc. help it, and what foods make it worse?
Okay, so that's where the same thing we were just talking about chemotherapy and neuropathy. And I have not seen a lot of benefit with Nervala alone doing that. I think the full mitochondrial supplement that includes like PQQ and CoQ10 and L-carnitine, and then at the same time having a physical therapy or exercise program to increase the production of mitochondria. And then, of course, keeping the blood sugar normal would be essential. But I don't think, I think without a comprehensive program, I don't think the chemotherapy neuropathy gets better.
Okay. Cynthia had also said they are in remission from multiple myeloma and do not have cancer now, but they have neuropathy in legs.
Yeah, multiple myeloma causes neuropathy. Even if you don't do chemotherapy, multiple myeloma causes neuropathy. And it's essentially the same thing. The the myeloma is a lot of white blood cells making a whole bunch of extra proteins, and then the blood doesn't get through the capillaries very well. You have decreased energy production. So dealing with the multiple myeloma is actually the most important part for preventing or reversing neuropathy.
Okay. So what are the best ways to increase energy?
Okay, that I can answer. Number one, exercise. If you don't push your limit, you don't increase. And that's true with anything. If you go to the gym and your workout just includes some 5-pound weights, you go, okay, I lifted weights. You haven't reached your limit. You haven't done anything. So walking around doesn't increase your muscles either. You have to push and you have to go to your limit, and then your body says, oh, we've reached the limit. We better increase that limit. And then you go to your limit again, and then you increase the limit again. Energy is exactly the same. You don't make mitochondria until you push the limit, and then your cells go, oh, we need more mitochondria, and start making more mitochondria. So until there's a demonstrable need, it's not going to happen. So increasing energy. Number one, exercise. Number two, get your blood sugar under control, which is insulin sensitivity. The more insulin sensitive you are, the better off you are, because it allows you to use the proper amounts of glucose and fat. If you have insulin resistance, then you don't use fat and you just make less energy, because the fat is 60% of your energy. And you actually decrease that by having insulin resistance, because insulin blocks you from using fat for energy. So, number two, so exercise, insulin sensitivity, and then sleep. Sleep is actually very important for learning, for energy production. You don't make the mitochondria except during the anabolic phase. And the anabolic metabolism only happens when you're asleep. And we call it the 6-10 reset. Stop eating by 6 o'clock so you have an empty stomach by 10 o'clock when you go to sleep. That way you make a hormone called ghrelin from your stomach, which is growth hormone releasing hormone. Then you release growth hormone, which tells your body to make more energy, mitochondria, right? And to rebuild your muscles and repair everything. So that's it's clearly energy. That's the way to do energy.
Okay. Question about drinking water. What is best, alkaline, acidic, or just purified?
I don't know. I've been doing some research on alkaline, and an alkaline diet is definitely better for your body. Like your energy systems function better on an alkaline, a little more alkaline. And there's very small differences, but just a little bit more alkaline is better than a little bit more acid. So is the alkaline water better? And that's what I don't know, because most of the research that I've read is junk research done by companies that are trying to sell very expensive alkaline water machines. But there was actually a couple of them that were really good, and that was a half a teaspoon of baking soda in water every day was enough to alkalinize the urine to some extent and help get rid of uric acid and decrease gout. In fact, one of the ways if someone has a gout attack is they just put baking soda in water and drink it, and then more baking soda in water and drink it every hour or every couple of hours. They do that until their uric acids dissolve, the crystals dissolve, and then their gout attack goes away. So, I would say maybe alkaline water is better, but if it's a lot more expensive, then just put some baking soda in it.
Yeah.
It tastes terrible. I hate it.
All right, let's see here. Next question from Judy. What about infants born with a drug dependency from the mother? Can those babies be habilitated and eventually have less dependency and naturally have less stress and anxiety?
Okay. The answer is yes, generally, because human beings are plastic. And by the word plastic, I mean moldable. So just because you've had an experience doesn't mean that that's the way it always is. However, having said that, there are things that have indelible imprints in minds and bodies. If you had a trisomy 21, then you're going to have these issues from your extra chromosome that are going to be throughout your life, and that's not going to change. You're not going to be different totally in that way. So an infant that's born with a drug dependency may have issues of stress and anxiety throughout their lives that they will be dealing with. And so it may not be that they walk around without any issues at all. It may be that just they deal with it.
Mm-hmm. Okay. Martha had said, can Nervala reduce carotid artery blockage?
Probably not. That's not what it's for. It's not what it does. Reducing carotid artery blockage is finding out why it's there, first of all. So if you have like lipoprotein A, LP little a, that's really high, then you don't dissolve clots very well. Or if you have clotting factor problems or making extra clots or something like that, then that needs to be fixed. If you have a problem with the glycocalyx or the lining of the arteries, then that needs to be fixed. So find the problem and fix that first. Find out why it's there. And I usually look at tests like, what is lipoprotein A, and fix that. And we talk about that in the book, the heart disease book. And let's see, what else? Apolipoprotein B can be helpful. Also, clotting factors. I look at a D-dimer level. D-dimer is the marker for breaking down clots in your arteries. So you have internal clots going on. Everybody has a little bit, otherwise you'd bleed to death. So, everybody has some clots forming wherever there's damage to arteries and stuff, which can happen randomly. But there should be like a low level, and the higher it is, the more clots you have. So someone who has a really high level, it means they're making a lot of clots in their arteries. And then the next question of why is that happening? And then looking at lipoprotein A and inflammatory markers and infectious diseases and all that stuff.
Okay. Anonymous says, I've been using Nervala for over a year and it cancels the sharp pain in both feet and the tingling while trying to get to sleep. The numbness continues. However, I've discovered that spraying Easy Relief Magnesium has been a very positive result and numbness decreasing in both feet. Don't know if the spraying magnesium is working for spraying directly to the feet, working, or spraying directly to the feet is the result for your info.
Wow, that is really interesting. So here you have somebody who's using it, Nervala, for over a year, and seeing some benefit from it. Interesting.
Mm-hmm. I use my Easy Relief Magnesium daily as well, so I love it. Whitney said, should you take your supplements like Nervala on a 3-day fast?
No. If you're doing a 72-hour water fast, then just drink water. there's no need to take any supplements. Consider all the supplements food. Some medications you will need to take, but like thyroid medication and certain other ones, clotting or blood thinners, you may need to take. But all of the supplements, consider them to be food, so you can go off those.
Okay. It says, so Iman says, my doctor did a neuropathy test with a pin touching my toes. Couldn't feel anything. Okay on sole and heel each foot. Any suggestions? Blood A1C 5.3 maybe?
5.3, yeah. 5.3 is normal. That's not bad. So now you have an issue. Okay, so you have your toes are numb. And so the question is, why are they numb? Is it only on one side or is it on both sides? But even if it's on both sides, you could have a constriction in the artery or in the spinal cord. You could have compression of the spinal cord causing that kind of thing. So look for the cause, because something like that would require surgical repair. If your A1C is 5.3, it's unlikely that you have a diabetic neuropathy. There's some other kind of neuropathy that you need to work on, because it could be toxic neuropathy, it could be cancer neuropathy, it could be, like I said, a compressed nerve in the spinal cord. So look for the cause.
Okay. I saw a question come in here. Cynthia said, what is mitochondria?
Mitochondria. Oh, that's a good question.
Mm-hmm.
Okay, so this is actually really amazing. So you have a cell, and every single cell in your body has something in it called mitochondria. And they're little teeny, they're just like bacteria, actually. They're about the size of bacteria. They have DNA of bacteria. They reproduce all by themselves, separate from the cell. Um, and you got them from your mother, because sperm have no mitochondria in them, but the egg does. And so the egg, all of the cells that are reproducing are bringing mitochondria with them until you have 60 trillion cells. The one started with just the egg from your mom, and they're just tiny bacteria. There could be thousands in a cell, like your heart cells have thousands of mitochondria in them, and they're all just making this what's called ATP. That's your energy. So these are the powerhouses of your cell. This is the generators of your cell, and they're generating all the power that you need for that cell to function. So a cell that doesn't need a lot of energy, like a fibroblast in your tendons or something, they may have one or two mitochondria. And then the ones that are like heart beating every single minute without fail, can't stop ever, has thousands of mitochondria, because it needs that much energy all the time.
I love it. These are good questions. Last question I'm going to ask is, someone had posted, does the Barton team ever market on Amazon? And yes, we do have our own products there as well. Okay. Do you need to go, Dr. Saunders? Was that
Yep.
too much? Yep. Okay.
Okay.
Good to see you. Thank you so much.
All right.
Cheryl, we do have our own products on Amazon as well, though,
Yes,
correct?
and I replied to that
Okay.
question. I don't know if that's published publicly or for everyone to see, but we do have a Barton Nutrition Amazon store, but only buy from Barton Nutrition. For some reason, there are people who love to make dupes, not just of Nervala, but of Synachroma, of our other products. And we're pretty good about getting them off of Amazon. But if you want to try, do not buy. We have also a Walmart store, but only buy from the Barton Nutrition Walmart store. Anybody else selling our products, you're not going to get the legit product that we have. So we would caution you about buying from any other sellers.
All right. Okay, that's it for today. Thank you so much for all of your questions. Thank you, Cheryl.
Yeah.
And we'll see you guys soon. Tell a friend about Barton Nutrition. Actually have them go to bartonwebinar.com. You'll find a link to our YouTube channel, and you can watch all of these past webinars as well. All right.